EKOS Corporation, a BTG International Group company, presents the Ekosonic Endovascular System. The system consists of the EKOS Control Unit 4.0 and EKOSonic device. Through a series of short videos, you'll learn the basics of how to use this unique and potentially life-saving technology from start to finish, including technology and system overview covering Control Unit 4.0 and EKOSonic device, device preparation, device placement, infusion setup and device securement, Control Unit 4.0 setup and operation, troubleshooting the control unit, and follow-up guidelines. Technology and system overview. The EKOSonic Endovascular System consists of a single-use infusion catheter, an ultrasonic core, and a reusable EKOS control unit. The EKOS technology is designed to gently dissolve thrombus and restore blood flow while reducing the risk of complications. EKOS treatment is effective in both the venous system for upper and lower extremity DVT, as well as arterial system for occluded bypass grafts, critical limb ischemia, and native vessels. In May 2014, EKOS also received FDA clearance to treat pulmonary embolism. Here's how it works. The EKOS technology, acoustic pulse thrombolysis, is a highly advanced proprietary technology that uses ultrasound in combination with a thrombolytic drug to quickly, safely, and effectively dissolve thrombus. There are two mechanisms of action. The ultrasonic energy thins and separates the fibrin strands, exposing plasminogen receptor sites, which are embedded in the thrombus. Secondly, the thrombolytic drug is actively driven into the clot via acoustic streaming. The combined effect saturates the thrombus with the lytic, which results in rapid thrombolysis. In the next section, we'll start to look at the individual elements of the system more closely. The EKOS Control System 4.0 includes a portable control unit and the connector interface cables, or CICs. The Control Unit 4.0 offers new functionality and workflow-based intelligence for EKOSonic endovascular devices, both at the procedure table and in the ICU. The unit drives the transducers of the ultrasonic core, generating acoustic waves that thin and separate the fibrin strands and disperses infused solutions into the treatment area. It is designed to continually monitor the output power and temperature of the device. As you may be aware, many patients for both PE and DVT require bilateral treatment. It is estimated that over 80% of PE and 30% of DVT cases are bilateral. The new Control Unit 4.0 can manage two EKOSonic devices simultaneously to support bilateral PE, DVT, and PAO cases. It is small, lightweight, and easy to maneuver. Additionally, the touchscreen displays a step-by-step guide for setup, operation, and basic troubleshooting. This is an especially useful feature for your staff that makes troubleshooting intuitive and shortens the learning curve with the unit. The unit also has a built-in battery to make it easier to transport patients from the lab with zero interruption in therapy. The battery is only intended for short periods when power is unavailable. During operation on battery, output power to the devices is reduced by 50%. It is important to always keep the control unit plugged into a hospital-grade outlet during use and storage. A fully charged battery provides power for 1 hour if 2 channels are running, and 2 hours if 1 channel is running. Control Unit 4.0's improvements in ease of use support your team by making workflow easier, more integrated, and less stressful. Easy-to-read messages and icons are displayed to indicate the state of the control unit and devices. Green, yellow, and red color coding is used to help communicate the importance of these messages and icons. Green indicates the channel is ready, running, or generally without issue. Yellow indicates further steps are required to start the ultrasound. Red indicates there is an error or issue that requires further steps to resolve. Now that we've covered the control unit, let's learn more about the device. The EKOSonic device consists of the infusion catheter and the ultrasonic core. The infusion catheter delivers physician-specified fluids, while the ultrasonic core simultaneously delivers ultrasound energy to the treatment site. Let's take a closer look at the infusion catheter. The infusion catheter is an 035 guidewire compatible 5.4 French catheter that will go through a 6 French sheath. The connector assembly is located at the proximal end of the catheter. 2 ports are marked to differentiate the drug lumen, labeled drug in red, and the coolant lumen, labeled coolant in blue. The port labeled drug splits into 3 lumens that are located radially around a central coolant lumen. The thrombolytic drug will infuse through the port labeled drug and will be delivered out the side holes along the treatment zone on the outer walls of the infusion catheter. The treatment zone is marked by 2 radiopaque markers, 1 proximal and 1 distal. The perfusion ports are laser drilled, about half the size of a human hair. It is important to know that you should never aspirate blood into the drug lumens, or the perfusion pores may become occluded, preventing the drug from infusing. Normal or heparinized saline will infuse through the port labeled coolant and exit the distal tip of the infusion catheter. There are therapy optimization sensors in the catheter that continuously monitor the device temperature. The sensors, along with the coolant, ensure that the device operates within safe temperature limits. Now, let's take a look at the ultrasonic core. The ultrasonic core incorporates up to 30 radiopaque transducers along the distal length of the core. The transducers emit ultrasound energy radially along the axis of the treatment zone. Lastly, all communication between the device and the control unit happens via the black, ultrasonic core, and gray, infusion catheter, electrical connectors. As a final note, the Ekosonic endovascular devices are only for use with the EKOS control unit. Device preparation. In this video, we will show you how to prep the EKOSonic device. Obtain access and place a 6 French or larger sheath as per standard practice. Do not use an introducer sheath with a rotating hemostasis valve, as it may result in removal of the radiopaque marker bands or damage to the catheter. Advance an 035 exchange length guide wire across the treatment site. Remove the angiographic catheter, leaving the guide wire in place to facilitate placement of the EKOSonic device. The EKOSonic endovascular device comes packaged as a kit. Each box contains 2 sterile packages, the infusion catheter and the corresponding ultrasonic core. The EKOSonic device is available in a variety of treatment zone lengths to precisely match the length of the clot to the length of the treatment zone. Select the device with the appropriate working length and treatment zone. Remove the pouches from the box and, using sterile technique, place the contents onto the sterile field. Open the first package containing the infusion catheter. Carefully remove the infusion catheter from the protective coil. Ensure that the gray electrical connector does not get wet during preparation. Place a 3-way stopcock on the drug port and flush with heparin or physician-specified fluids using a 3 or 5 cc syringe until fluid exits the most distal catheter perfusion pores. Turn the stopcock off to the catheter. Next, place a 3-way stopcock on the coolant port and flush with heparinized saline until saline exits from the proximal central coolant or guide wire lumen. Place your finger over the central coolant lumen and continue to flush until saline exits from the distal tip of the infusion catheter. Turn the stopcock off to the catheter. Finally, flush the central coolant or guide wire lumen. Open the second package containing the ultrasonic core. Isolate the black connector so it doesn't get wet. Moisten the outside of the ultrasonic core by either infusing heparinized saline into the luer fitting of the protective coil, or remove it from the protective coil and wipe it with a wet 4x4 gauze sponge, taking care to avoid kinking the device. The device is now ready for insertion. The next video is an overview of device placement. Device placement. Using fluoroscopic guidance, advance the infusion catheter over the guide wire. Remove the guide wire and flush the guide wire lumen. Insert the ultrasonic core into the central coolant lumen of the infusion catheter. Start with 1 centimeter increments until transducers are introduced to avoid kinking during advancement. When the ultrasonic core has been fully advanced into the infusion catheter, lure lock the ultrasonic core to the catheter. Stabilize the device prior to connecting infusions. The following video discusses infusion setup, infusion setup, and device securement. Select the appropriate infusion stand following the specifications in the EKOS Control Unit 4.0 IFU. 2 hospital infusion pumps are required per catheter for the procedure. The EKOS Control Unit doesn't control the infusions. Spike the infusion bags and prime the fluid chambers. Flush to remove all air from the lines. Clamp the lines. Consider using sterile extension tubing to start the infusions before breaking the sterile field. Connect the IV line on the infusion pump containing the physician-specified dose of thrombolytic to the stopcock attached to the port marked drug. The minimum infusion rate through the drug lumen is 5 milliliters per hour, and the maximum is 35 milliliters per hour. Keep in mind that infusion rates higher than 35 milliliters per hour could trigger a downstream occlusion alarm on the infusion pump. Forward flush to remove air from the connection. Insert infusion tubing into the pump, start the pump, and turn the stopcock on to the catheter. To ensure proper infusion and reduce the potential for infusion pump alarms, the infusion pressure setting on the pump should be set to the highest value allowed by hospital policy. A minimum of 10 psi or 500 millimeters of mercury will reduce the potential of downstream occlusion alarm. Connect the IV line on the infusion pump containing the normal or heparinized saline to the stopcock attached to the port marked coolant. The minimum infusion rate through the coolant lumen to ensure proper device functioning is 35 milliliters per hour. The maximum is 120 milliliters per hour. 35 milliliters per hour is usually sufficient. Forward flush to remove air from the connection. Insert infusion tubing into the pump, start the pump, and turn the stopcock on to the catheter. A physician-specified fluid will be infused via pump or pressure bag through the sidearm of the sheath. Now, attach end caps to the exposed ports on the 3-way stopcocks. Finally, secure the device with Tegaderm, Steri-strips, tape, or follow standard hospital stabilization procedure. Refrain from coiling the catheter too severely. The next video demonstrates how to set up the control unit for operation with the device. Control Unit 4.0 Setup and Operation. To prepare the control unit, ensure the control unit is attached to a recommended infusion stand or placed securely on a table or cart near the patient. Place the pole inside the mounting bracket that is located on the back of the control unit and turn the knob clockwise until it is tight. Ensure that it is securely attached to the pole. Connect the power cord of the system to an appropriate hospital-grade outlet. Press the power button on the front of the control unit. The EKOS boot screen, followed by the logo screen, displays as the system performs a self-test. Now, let's take a closer look at the control unit's tabbed menu. The Home tab shows cable connection status, instructions, and ultrasound runtime information. Under the Information tab, the control unit model number, connector interface cable, device serial numbers, and the EKOS helpline number are displayed. The graph displays the amount of power delivered for each channel. The Settings tab is where you can adjust alert tone volume, screen brightness, and choose a language. To the far right of the tabs, the AC power battery status is displayed. Now let's walk through how easy and fast it is to set up treatment. The control unit screen indicates that both channels A and B are available and ready. Press the Activate button. The unit will prompt you to plug in the connector interface cable or CIC. Connect the CIC to channel A or B on the front panel of the control unit. If you are using 2 devices, connect a CIC to each channel. Notice that treatment has not started, and we will still need to plug the device connectors into the interface cable housing. Connect the black and gray cables from the device to the CIC. They plug into the connector interface cable, black to black, gray to gray, symbol to symbol. As you can see, the CIC indicates which channel it is plugged into. When using more than one device, check to make sure that the black and gray cable pair from one device is connected to the same corresponding CIC. Once the device is connected, a ready message is displayed. Confirm infusions are running and press the Start button on the control unit for the appropriate channel. If the Start button is not pressed within 5 minutes, it will alert you. Pressing the audio pause button on the control unit silences the reminder for an additional 5 minutes. When ultrasound is running, a green running indication is displayed, white bands animate, and a runtime clock counts up. If using both channels, the running status is displayed independently for each channel or device. Monitor the timer to determine how long the device has delivered ultrasound therapy. The time is shown in hours, minutes, seconds. Time segments not yet reached are dimmed. To stop or pause the ultrasound, press the Stop button on the control unit for the appropriate channel. When the Stop button is pressed, the Ready to Start instruction and total elapsed runtime is displayed. If therapy is not resumed within 5 minutes, the Start reminder activates. Note that each channel operates independently, so the ultrasound can be stopped for one or both channels at any time. To restart the ultrasound therapy, press the Start button on the control unit for the corresponding channel. The runtime will resume from the time when it was stopped. As you can see, in just a few minutes we're up and running with the new intuitive EKOS Control Unit 4.0. This control unit is a significant improvement in usability over previous EKOS control units in almost every way. The patient may now be moved to an appropriate care unit of the hospital and monitored per hospital standard of care. To prepare for moving the patient, unplug the control unit and secure it for transport with the patient. When the patient reaches the patient care area, be sure to plug the control unit into a hospital-grade outlet. During operation on battery, outlet power to the devices is reduced by 50%. It is important to always keep the control unit plugged into a hospital-grade outlet when possible during use and storage. As a reminder, a fully charged battery provides power for 1 hour if 2 channels are running and 2 hours if 1 channel is running. Troubleshooting the control unit. The Control Unit 4.0 continuously performs extensive self-tests to ensure that your patients safely receive optimal therapy. Occasionally, the control unit will alert you to a problem. The control unit will use its extensive intelligence and clear messages to guide you in fixing errors. When an error occurs, an error message with an alert icon displays and an audible tone sounds. Press the audio pause button on the control unit to silence the alert tone for 5 minutes. Read the error message and follow the instructions to attempt to correct the error. Once the error is corrected, the alert icon will disappear and the Ready to Start instruction is displayed, indicating the total elapsed runtime for the ultrasound therapy. To restart the ultrasound, press the Start button on the control unit for the appropriate channel. The runtime will resume from the time at which it was stopped. Confirm therapy is running. When ultrasound is running, a green running indication is displayed, white bands animate, and a runtime clock counts up. Some error messages will prompt calling the EKOS helpline. If the issue cannot be resolved, note the error code in parentheses at the end of the message and contact EKOS helpline. The U.S. helpline number can be found under the Systems Information tab. The number is staffed by customer service experts and clinical specialists 24/7 should you have any questions or concerns. Customers outside the U.S. can contact their local EKOS representative or call the number on the screen. You can also check the troubleshooting section in the control unit instruction for use or the quick reference guide for more information. The next video covers typical follow-up procedures. Follow-up procedure. When the infusion therapy has been completed, the Ekosonic Endovascular device may be removed at bedside without fluoroscopic guidance, or it may be removed under fluoroscopic guidance according to physician's order. Stop ultrasound therapy. Press the Stop button on the control unit for the appropriate channel. Turn off the control unit. Press and hold the power button for 3 seconds to turn off the control unit. The shutdown screen displays as the control unit shuts down. Disconnect the ultrasonic core and infusion catheter from the connector interface cable or CIC. Store the CIC with the control unit. plug in the control unit at all times, including when in storage, to ensure a fully charged battery. Turn stopcocks off to the drug and coolant ports so no air is introduced into the vasculature. Discontinue infusions. Coil the black and gray cables separately. This prep requires 2 people. One person holds the coiled wires and device away from the patient. The sterile person dons 2 pairs of sterile gloves and places a sterile towel on the patient in the area to be prepped. Fold a second sterile towel in half and place it on the first sterile towel. This towel is going to be pulled through the eye of the sterile drape. Make sure that this second towel is fully resting upon the first sterile towel. Decontaminate the sheath and device using standard sterile technique. Continue to decontaminate the device, hub, and black and gray wires until you get to the proximal coiled cables. Grab the first coil with one hand and pull off your top glove to cover the cable. Secure glove with steri-strip. Repeat this procedure for the second cable. Be careful not to get fluids in the connectors. Keep the connectors dry at all times. Wrap the device and cables in the sterile towel. The sterile operator carefully passes the sterile bundle with the device through the opening in the sterile drape. Unwrap the towel. Remove the ultrasonic core from the infusion catheter and flush the guide wire lumen. Angiography may be performed at this time to assess the treatment site. For full assessment, angiography may be preferable to a contrast injection through the sheath. Do not connect the infusion catheter drug or coolant infusion ports to a power injector. Do not exceed 200 psi applied to any infusion port. If additional intervention is required, place the guide wire through the infusion catheter and then remove the infusion catheter, leaving the guide wire in place to facilitate placement of interventional devices. Following the procedure, removal of the introducer sheath, attaining hemostasis and patient discharge should be performed per hospital standard of care.